Thank you very much. After those fascinating videos and direct, live transmission from the lab, it's very energizing that such a high quality work happening in our in some of our labs in country. I'll share briefly about cell-based approaches for ocular surface translational research. I have no commercial interest to declare. Here is a 9-year-old boy brought by his father from Maharashtra. He had this appearance in the left eye following a accidental chuna injury, and the boy was brought up because he wanted the eye to be removed. He was not able to go to school, and the father said, please doctor, remove this eye, because many doctors told that nothing can be done about it. What we did was a technique called simple limbal epithelial transplantation, in which we take small limbal biopsy, cut into pieces, clean up the ocular surface, and this is what you can get. So to achieve these kind of results, we were able to do because we were doing from 2001 the cell-based cultivated limbal epithelial transplantation, which means we are harvesting the limbal biopsies. From there, we are growing the cells for 2 weeks diligently, and then we are transplanting in human affected corneas. And this is an example of a patient who has 22-year follow of a autologous cultivated limbal epithelial transplant followed by a PK, and she is now a grown-up lady, and when she had this injury, she was about 10, 12-year-old. When we have such a cornea, most of the doctors about 10 years back used to think that nothing can be done about it. When we did a slit in this patient in 2011, you can see there is some scarring, and at that stage we used to think, okay, we need to do a DALK or a PK, and we offered that to this patient in 2012, but he said, doctor, I have enough surgery, I don't want. So he continued to follow up, and to our surprise, cornea continued to clear. And in 2016 he improves to 2040, and why and how this happened? This we thought when we were growing the cells in the lab, we realized that there are mesenchymal cells in the cultures, and when we compared the gene markers of gene signature of those cells and bone marrow derived mesenchymal cells, they are very similar. Based on that idea and based on the work of Professor Fundenberg from UPMC Pittsburgh, we started working on the idea that okay, mesenchymal cells can be a solution for many of the corneal disease. And why we think that way? Because if you're a cell biologist, you will look at, well, there is a narrow window between a fibroblast and a myofibroblast, and there are various factors working on it, microenvironment and the cytokines, to develop into a transparent cornea or a scarred pathological cornea. The work of Sunil Chauhan from Harvard Medical School and Pittsburgh and our own work made us understand that these mesenchymal cells are very important cells in the body and in all the organs, because it can help improve the microenvironment, it can support the progenitor, tissue specific progenitor cells, and it can immunomodulate. So based on this work, Sunil Chauhan's group has worked out that HGF is the key part of the secretions or cytokines, and based on that, they have a neurotrophic keratitis clinical trial, which is now done by a company called Claris Bio, and that is a startup. And I think the mesenchymal cells are answer to many of the treatments or the disease that we see. For example, a patient with chuna injury, we can treat him once we remove the chuna and use the mesenchymal cells which are grown, or maybe exosomes derived from the mesenchymal cells. These exosomes, we are working very closely with a company called Pandorum, which is a startup from Bangalore, and we are able to develop tunable exosomes. Exosomes are small vesicles, nanovesicles, which contain all kinds of cytokines, growth factors, and they can be very tissue specific. So I'll give you an example of that tissue specificity, that we are developing a product called Curogenics, which is liquid cornea essentially, and we are developing for neurotrophic keratitis. And this is a rabbit model where we have published extensively and shown that it is quite effective. And this is the paper we recently published, that Curagel, which is a hydrogel functionalized gelatin and hyaluronic acid, along with the exosomes derived from the mesenchymal cells. And this is, the beauty of this product would be that you use a drop and show the microscope light for 30-40 seconds, and it polymerizes and becomes a solid in place. Corneal epithelium grows over it, and it gets integrated. And this is an example of a rapid surgery that we are doing. When the scar is created, then you remove the scar and fill that crater with the liquid gel, and leave for 30 seconds, solidifies, and the corneal epithelium will grow over it, and that's it. So what we are thinking that, this is a human scar, the same video clip. So now if we have to treat this patient, either you have to do a DALK or you have to do a PK, but most clinicians say this is scar not very big, maybe not a good idea to do surgery. But once you have the liquid cornea, you will say, yes, we will treat it, we'll remove the scar and then fill the crater with the liquid cornea part. Similarly, when you have keratitis being treated, whatever the type of keratitis, they reach a stage of neurotrophic stage. At that stage, you can introduce this liquid cornea with exosomes, and that can restore the transparency. Similarly, I think this kind of treatment in fungal keratitis, when you have early fungal keratitis, instead of using for many, many weeks and months topical antifungals, maybe I can remove this infected area and fill the crater with the liquid cornea. So I think this would change how we look at the corneal diseases. Similarly, when you have bacterial keratitis or infectious keratitis, when the infection is healed, you have PED or you have neurotrophic element. At that stage, you can start treating with exosomes or combined with the gel. So when we do translational research, and what Rohit and his group were showing from the GROW lab is basically identifying a potential treatment, then do your preclinical studies, animal models. That's what I just showed you, and that's what we are doing. And then you move on to, once they prove the safety and efficacy, you move to human trials. And currently at that lab in SCH, we are working on Stevens-Johnson syndrome, the molecular basis, VKC. We think that mesenchymal cells or exosome-based treatment is possible. Similarly, we are working on OSSN and corneal fibrosis and chemical and thermal burns. These are the markers, the different students working on these disease models that I described. So in summary, cell-based approaches are key for the development of new treatment for cornea and ocular surface. And I go back, when I started corneal cultivated limbal epithelial transplant in 2000, 2001, that led to SLET. And when we're doing the bioengineered cornea, that led to the concept of liquid cornea. So translational research accelerates novel therapies for ocular surface disease, bridging molecular insights with clinical applications, and future prospects of personalized medicine and advanced nanotherapeutics can be fulfilled. Thank you very much for the kind audience.
Thank you.